Good morning, good afternoon, good evening all. A very warm welcome on behalf of the IPD events team. We are very much looking forward to supporting you with today's Eye Health and the Commonwealth webinar. I'm now delighted to hand over to Peter to welcome you to the webinar. Thank you.
Debbie, thank you very much. Your Royal Highness, Secretary General, Excellencies, Honourable Ministers, colleagues from the eye health sector, welcome to today's event on eye health and the Commonwealth. As Debbie said, I'm Peter Holland. I'm Chief Executive of the International Agency for the Prevention of Blindness. We're the overarching alliance for the global eye health sector. I'm also Chair of Vision for the Commonwealth, which is a coalition of eye health organisations active and working in partnership with governments across the Commonwealth. And we're absolutely delighted to be hosting today's event. The Commonwealth Heads of Government meeting in April 2018 was groundbreaking for the global eye health sector. It was the first ever global summit where eye health was on the agenda. And at that meeting, heads of governments committed to take action towards achieving access to quality eye care for all, including eliminating blinding trachoma by 2020. And they agreed to review progress every 2 years. So today we're launching a report which we commissioned on behalf of the Commonwealth Secretariat. The report presents the progress that's been made on those commitments, and it's intended as input to this week's meeting of the Commonwealth Health Ministers, and later in the year as the basis for a report to CHOGM. The main message of this report is, despite the challenges that we've all faced in the past year of the COVID-19 pandemic, very encouraging progress has been made, both in the elimination of trachoma and in access to quality eye care. And I want to just very briefly give you some of the highlights. Across the Commonwealth, the number of people at risk of trachoma has nearly halved since 2018, from 42 million to 24 million people. 2 Commonwealth countries, Ghana and the Gambia, have achieved elimination of trachoma, and they're the only sub-Saharan African country to do so far. And one of our speakers, Harper, will talk more about this later, and the extraordinary collaboration that's made it possible. On access to quality eye care, we need more data to track it precisely, and indeed that's one of the recommendations of the report. But the report shows that there has been a range of initiatives across every Commonwealth region, both to better plan and to deliver people-centred eye care as part of universal health coverage. And another really important aspect is that CHOGM's commitment to eye health in 2018 marked the starting point of heightened interest in and attention to eye health at the international level, with Commonwealth countries playing a really prominent role. In 2019, the World Health Organization published their first ever World Report on Vision, which set out the scale of the issue. Over 1.1 people worldwide have sight loss because they don't have access to the basic eye care they need. And the World Report on Vision also set out a framework for addressing it. Last year in 2020, a World Health Assembly resolution on eye health was agreed, where member states committed to implementing the World Report on Vision's recommendations. And we hope this year that will be followed indeed at next week's World Health Assembly, with agreement on targets to be achieved by 2030. And at the UN Friends of Vision Group, with 2 co-chairs from Commonwealth countries, is championing eye health, with the first UN resolution on eye health expected in the coming weeks, which draws out the strong connection between eye health and achieving the Sustainable Development Goals. So in the first part of today's programme, our speakers will reflect on the progress that's been made. The second part of the programme will look ahead, bearing in mind the declared intention that the next CHOGM should build on the outcomes of the last. So the report's key recommendation is that the Commonwealth should commit to school-based eye tests and care for all children to boost educational attainment and life chances for present and future generations. And that will be the focus of the second part of the programme. And then, as Debbie has said, in the final part of the programme, there'll be an opportunity for questions and comments. And please do post your questions throughout the programme in using the Q&A function. So I'm now absolutely delighted to introduce our first speaker, Her Royal Highness, the Countess of Wessex. Her Royal Highness has been an extraordinarily committed supporter for the cause of eye health for many years, both as our global ambassador, but also as vice patron of the Queen Elizabeth Diamond Jubilee Trust, where she came to know well many eye health programmes across the Commonwealth, many of which are described in the report. So, Your Royal Highness.
Thank you very much, Peter. and it's wonderful to be with all of you today. 3 years ago, the Commonwealth heads of government made a landmark commitment to eye health. In making this commitment to take firm action towards achieving access to quality eye care for all, the lives of millions of people across the Commonwealth have been transformed. The next CHOGM meeting that takes place will be an opportunity for ministers to look back over the last 2 years and also agree the next steps. What will be evident through the reports presented is that huge steps have been taken to address many of the avoidable and treatable eye conditions that have blighted the lives and opportunities of so many. During my time as Vice Patron of the Queen Elizabeth Diamond Jubilee Trust, I had the pleasure of travelling to a number of Commonwealth countries to witness for myself the work being carried out by governments, agencies, and everyone coming together. In Malawi, I met children learning about the importance of clean hands and clean faces to help them fend off blinding trachoma. In Bangladesh, I attended a meeting of rural women being educated about the dangers of diabetes. And in India, I saw tiny babies being screened for retinopathy of prematurity. The effects of education about health issues, access to early intervention, and the availability of effective treatments have all combined to drastically reduce the numbers of people needlessly losing their sight. Each of these experiences, and the countless others that I have had during my work with avoidable blindness for more than 20 years now, have proven to me time and time again that when individuals, agencies, companies, and governments all work together, the outcomes are profound and life-changing. Only last month, I was thrilled to speak with the Health Minister of the Government of the Gambia and celebrate with them as they announced the elimination of blinding trachoma. Only the second country in sub-Saharan Africa after Ghana to have reached this milestone. But so many other countries have also made incredible and positive strides forward to improving the eye health of their communities too. What is clear is that this is very much about a team effort. It has to start at the top with government commitment, but then it is down to the many incredible individuals who work within the eye care health system to deliver. And given the support, deliver they do. From the local eye health teams to the agencies and NGOs, from the amazingly creative research technician whose technology is being used worldwide, to the ophthalmologists and nurses treating patients in hospitals. Every one of them are playing their part in ensuring that the child whose life might otherwise have been one of no horizon is now one with endless horizons. The woman who's never seen her grandchild can now help her daughter to look after her. And the man who has had to stop work and cannot feed his family can now rebuild his life and offer his family a future. What is also clear is that as the world changes and populations increase, the issue of poor eyesight is set to grow and will continue to require attention and commitment in the years to come. And in order to be effectively tackled, it will need to remain high up the health agendas of all governments. My hope is not to have to persuade you that this is the right thing to do, but that the proof of effectiveness is here for all to see, that the ability to change life chances for all are within our grasp, and that this important area of health remains a key priority for Commonwealth governments now and in the future. While I understand all too well that healthcare has been under enormous pressure these past months, and that the COVID-19 pandemic has inflicted huge pain and loss everywhere, I am also heartened to see how much has been achieved in eye health in every region of the Commonwealth in the last 3 years. So my thanks go to the Commonwealth governments and their communities for the continued commitment to this important issue and for choosing the gift of sight as a key priority. And please be in no doubt that I will continue to follow all of your progresses closely. Thank you, Peter.
Your Royal Highness, thank you very much indeed, and thank you for your support, which I know has been inspirational for us. And I very much echo your thanks to governments across the Commonwealth for their commitment to eye health. I'd now delighted to introduce our next speaker, Her Excellency Secretary General of the Commonwealth, Baroness Patricia Scotland QC. She's also a great friend of eye health in the Commonwealth. She has been trustee of the Queen Elizabeth Diamond Jubilee Trust from its outset in 2012. Secretary General. I think you're muted.
Thank you very much. Your Royal Highness, Excellencies, distinguished fellow panelists, Commonwealth friends and colleagues, greeting. It's a pleasure to address you and to connect with you as we carry forward our Commonwealth engagement on this important priority for so many people in all 54 of our member nations. When our presidents and prime ministers met in London for the 2018 Commonwealth Heads of Government meeting, they committed to, and I quote, "Take action towards achieving access to quality eye care for all, including eliminating blinding trachoma by 2020, which disproportionately affects women and children across the Commonwealth." Since then, and building on the collective commitment, I'm pleased to say there have been positive developments on eye health in every region of the Commonwealth. The number of people at risk of trachoma has almost halved, and Commonwealth countries are investing in eye health care and the workforce, and increasingly including eye care services in universal health coverage. Many Commonwealth countries have begun to address children's vision in schools, improving their school performance, health and well-being. Yet even with these commendable and encouraging achievements, eye health remains a major public health challenge. More than 1.1 billion people globally do not have access to the eye health services they need. Amongst our children, who are our future, 91 million live with vision loss. And distressingly, these figures are projected to rise. Compounding this, eye health, as with other areas of health, is also facing major disruption as a consequence of the pandemic and the increasing backlog of patient treatments following the interruption of services as healthcare delivery focused on combating COVID-19 infection. We need to sustain hard-won gains already made throughout the Commonwealth, which is why integration of eye care within and across health systems is such importance. It requires investment in eye health as a priority within universal health coverage plans and in fulfillment of our collective Commonwealth commitment to building a more equitable, more inclusive, and more resilient future in which all are able to share. This can only happen if we come together in goodwill with the mutual support and encouragement which are so characteristic of Commonwealth cooperation, to align our national and combined efforts and collaborate through robust partnership. Our Commonwealth Health Ministers meeting later this week is an opportunity for Ministers of Health from our 54 member countries to assess progress made on the 2018 CHOG mandate and to consider further steps towards the elimination of trachoma as a public health problem. There are proposals for more inclusive access to eye tests and for more affordable glasses and other vision treatments for children and young people in schools to accelerate progress towards vision for all. Commendable leadership and progress is being made in many Commonwealth countries towards successfully eliminating trachoma, the world's #1 infectious cause of blindness. Commonwealth connection and cooperation can help to mobilize the national and multilateral sense of purpose and practical partnership, which are so vital in attaining elimination targets. So I really want to thank Her Royal Highness, the Countess of Wessex, for all she's doing as Global Ambassador for the International Agency for the Prevention of Blindness to support and encourage collaboration towards that in the Commonwealth and more widely. Her leadership has been exemplary, her passion unwavering, and her support so needed. And I am so grateful to her for everything she has done. And she's never let us down. She's marvelous. So with such exemplary engagement and leadership, and with our own individual and collective energetic involvement on next steps by our Commonwealth family, we can all help to ensure that in every one of our nations, there is quality eye care for all. The Commonwealth has led the way. We can do this if we choose. And I'm so proud that we are choosing and we're doing it together. So thank you so much.
Secretary General, thank you so much for your remarks, which I think clearly set out the challenge, but I think that emphasis on leadership is really crucial, and we're enormously grateful for the leadership across the Commonwealth and that the Commonwealth has taken on eye health. We have two videos that we want to show you today from Vision for the Commonwealth members, which give just two examples of the life-changing work being done around the Commonwealth by non-governmental organisations. The first of these videos is from one of our partners, OneSight, and it tells the story of metalworker Jagan Mbowe, who is from the Gambia, and shows how a simple pair of glasses, an invention, of course, that's over 700 years old, can make a real difference to the lives of workers around the world.
These wares are very critically placed in the machine, and if you don't have a clear understanding of it, you cannot use it. And some of them are very tiny to an extent that if you don't correctly look at it with a pair of glasses, you find it very difficult to identify their different functions. In fact, this kind of job is the main reason why he went to the eye unit to look for a pair of glasses, because he knows that he was having eye problems. Before, he doesn't use a pair of glasses because it was a very expensive thing in the country, and what he did was he always go to the market and buy any type of glasses. When he do that, he will be experiencing eye problems, and sometimes he will not even be able to see his watches correctly, and that makes him worried a lot. So when he heard about the Vision Center at OneSight, he became very happy to go and get himself a good pair of glasses.
21 day, 3 weeks.
Before, he never knew a pair of glasses can be this important, and he was much convinced. When he came to the Vision Center, he found good guys there who explained the importance of a pair of glasses to him, and that really touches his heart, and he was very optimistic that when he buy one, he will be able to see clearly. After buying this now, he really see the real difference, because you know his life as before and now is something completely different. Now he's a very happy man doing his job better, and that is bringing more people to him, and he's earning a living thanks to having a pair of glasses.
My problem.
Yeah.
Thank you. And I guess the message of the video is that eye health and good eye care isn't simply about providing good health services. It has such a wider impact, whether it's on helping people stay in work, get good quality education, or indeed just participate in their everyday lives. Our next speaker is Her Excellency Ms. Karen May Hill, who's the High Commissioner of Antigua and Barbuda. And I'd like particularly to take this opportunity to thank her and her government for the leadership that Antigua and Barbuda are taking on eye health, particularly the role that she and her New York colleague, Ambassador Aubrey Webson, have played in highlighting the issue of vision and its importance in achieving the Sustainable Development Goals. Ambassador.
Thank you, Peter. Your Royal Highness, Secretary General, Excellencies, ladies and gentlemen. I am thankful for this opportunity to address this important event today on behalf of the government of Antigua and Barbuda. Almost 3 years ago, our heads of state and government made a commitment to advance eye health. The commitment itself was important, of course, but so was the forum. For the Commonwealth has not traditionally been a space for eye care discussions, and certainly not among heads of state. At almost the same time, across the Atlantic at United Nations in New York, Antigua and Barbuda's United Nations Ambassador, Aubrey Webson, was speaking with other governments about how to bring awareness of eye health and its potential to accelerate progress to achieve the Sustainable Development Goals to more member states, to more capitals. UN headquarters in New York is also not a typical forum for discussing vision or eye health. And why do these things matter? They matter because improving vision and enabling our societies to fully realize the benefits which would accrue is not the job of a single ministry or UN agency or NGO or company. It requires all of us to do more and to do more consistently. One doesn't need to be an expert in the SDGs to understand the benefits of clear vision. Vision can help address Goal 1, ending poverty. Goal 2, zero hunger. Goal 3, ensuring healthy lives. Goal 4, inclusive and equitable education. Goal 5, gender equality. Goal 8, decent work and sustainable growth. And Goal 10, reducing inequalities, and arguably other goals as well. Most of these links are quite frankly obvious. But to make the progress we need, especially after the damage from COVID-19, discussions about improving vision should be taking place in all relevant ministries and forums. We know, for example, that during lockdown, the risk of vision impairment is heightened. And the people with blindness or vision impairment are disproportionately more affected due to barriers to healthcare and pre-existing inequalities. Our approach must be more holistic, which is precisely the idea behind the SDGs, an integrated agenda designed to leave no one behind and to make the world a better place for all of us. In New York, those early informal discussions led to the creation of a UN Friends of Vision group of member states. Our group, along with allies across the United Nations membership, are now negotiating a first of its kind UN General Assembly resolution, Vision for Everyone, that Peter mentioned earlier. If adopted, perhaps I should say when adopted, this landmark resolution will begin to embed vision across the Sustainable Development Agenda, which in turn will ensure that all relevant parts of our government and society are working together to bring vision to everyone. Even the process of negotiating this resolution has already led to more discussions with capitals around the world about vision and its potential for SDG advancement. Whether it is in Commonwealth meetings, at the UN, or at the WHO in Geneva, we need to continue to expand this conversation and those participating in it. Today's vision for the Commonwealth Progress Report launch shows us that progress is possible. As you have heard from the previous speakers, the answers are clear. Improving eye health does not require an as yet to be invented tool or medicine. It requires us to prioritize, to collaborate, and to embrace the spirit of the SDGs, an integrated approach to development which leaves no one behind. I thank you.
Ambassador, thank you so much, and thank you again for the leadership that your government are taking, particularly in the UN. Just a quick reminder, if you are interested, if you have any questions or comments you'd like to make, we will have some time towards the end, and please do post them in the Q&A box at the bottom of your screen. I'd now like to introduce our next speaker, Caroline Harper, who's Chief Executive of Sightsavers, and who, as I mentioned earlier, will talk to us about the elimination of trachoma across the Commonwealth and where, in particular, Sightsavers continues to play a major role. Caroline.
Thank you very much, Peter. I think several speakers have mentioned that at the last CHOGM meeting in London, part of the communique was a commitment by all Commonwealth countries to eliminate trachoma. I hope most people on the call know that trachoma is a really unpleasant, painful disease, that it's infectious and it turns your eyelids inside out while your eyelashes scrape against the cornea and you slowly and painfully go blind. And we've made tremendous progress in the elimination of trachoma over the years, and actually particularly since 2018, despite the fact that we've all been facing the COVID-19 pandemic. Over 33 million treatments have been distributed, and several speakers have mentioned that the number of people at risk has about halved. In fact, even more incredibly, Nigeria, which is the Commonwealth country with probably the most people at risk of trachoma, that has gone down by 2/3. So we've made incredible progress on this. And then, of course, we've mentioned too the celebrations in Ghana in 2018, and really recently in the Gambia. Both countries being told by WHO they had been validated as having eliminated trachoma, showing it is possible. And I was privileged to be present at the celebration that the Countess of Wessex mentioned. And what a great joy it was to see something so positive in global health at a time when the news is otherwise quite dark. And I think we've got such great momentum in this program. I think in every country now, the mass drug administrations and the surgeries have restarted after a brief break during the early parts of the pandemic. And we will see some backlog, particularly in surgeries. We need to do some catching up there. But we've also got a number of countries at the dossier stage. So Vanuatu have submitted their dossier to WHO. And this will be something that I know the Countess of Wessex, Your Royal Highness, will be so pleased about, is that Malawi is currently preparing its dossier and will submit that to WHO later this year. And I hope to be able to have a great celebration, hopefully in Malawi rather than on Zoom, with Your Royal Highness, because I know Malawi is particularly close to your heart. So that's imminent, hopefully this year or early next. And then as long as the funding doesn't dry up, we'll see other Commonwealth countries coming to this wonderful situation too. Countries like Zambia and Kenya and Tanzania will all also be able to submit their dossiers and hopefully then declare trachoma as eliminated. And this is all down to the hard work of people in the Commonwealth countries, in the ministries, the community health workers, and especially I'd like to thank all the community volunteers who help with the distributions. Many of these people have been working for decades, selflessly serving their communities. These are the people that we rely upon to be able to distribute the drugs and reach to the farthest corners of the communities. Now, of course, it would not be possible to have made this progress without donors and their generous commitments. Particularly like to thank Pfizer for their continuing drug donation, and also the American government through USAID have been a huge donor to trachoma in Africa and to a number of Commonwealth countries. The thanks go to them. And there are now a number of philanthropists who've stepped up, people like Bill Gates, Chris Hone, Richard Branson, Elmer Foundation and others, and the donors to the End Fund and all the NGOs that have been mentioned like Carter Centre, CBM and Fred Hollows. But I think perhaps the most important donor to this programme in the Commonwealth has been Her Majesty's government. They had tremendous foresight to fund the wonderful Global Trachoma Mapping Project, the largest mapping project of an infectious disease in history, that told us where that disease was. They then funded a program called DFID SAFE, which invested in a number of Commonwealth countries and others to do implementation. And they then provided match funding to the wonderful Queen Elizabeth Diamond Jubilee Trust. There was a 5-year trust fund that chose avoidable blindness as its main thrust, and trachoma was the biggest program in that. Then FCDO funded the Commonwealth Summit Fund as part of that commitment in 2018, also 2 Commonwealth countries for trachoma. And then finally, most recently in 2019, they funded the Ascend programme, which covers a number of neglected tropical diseases, of which trachoma is an important one. So I think we can all in the Commonwealth have great pride in the trachoma programme, and especially the UK government. So I have to say, it was with great sadness and indeed surprise to hear that the UK government is planning to prematurely exit from the Ascend programme completely and abruptly this year, well before the contract is ended, thereby ceasing all funding for trachoma programmes. I'd like to say to you now, to the government, please can you reconsider this proposal? Please do not walk away from such a successful programme that is stopping people going blind in such pain. Please do not walk away from the formal commitment that you have made to the people of the Commonwealth, especially as you are still chair of office of CHOGM. And then as we approach the Platinum Jubilee year for Her Majesty the Queen, please do not damage the legacy, her legacy, which you have helped to build through the wonderful Queen Elizabeth Diamond Jubilee Trust. Temporarily cut the budget, yes, if you must do that, but please do not abandon this programme. We have come so far together, but we still have a way to go, and we need you with us. Thank you.
Caroline, thank you very much, and for emphasising obviously the success of the Trachoma programme. And I'd just like to echo your calls to the UK government to not walk away from the commitments that you've made to the people of the Commonwealth to eliminate trachoma, those commitments made just a few years ago, and indeed the legacy of the Queen Elizabeth Diamond Jubilee Trust. I now want to introduce our second video. Caroline's obviously outlined the amazing progress that's been made in the Commonwealth on the elimination of trachoma and the work that's still to be done. Australia remains a Commonwealth country that still has trachoma, and Vision for the Commonwealth partner, the Fred Hollows Foundation, have been working with communities in Australia to help empower community health leaders. And one of those leaders is Hazel, and this is her story.
Gonna wash my body, keep trachoma away. I'm a bit worried about Mum, all of like my other sisters too. With left eyes, she can't see properly, and her eyes are getting smaller and smaller. First I did the trachoma book about Nganga Chunagat, and the second we did the song about trachoma and the painting. This is trachoma, and this one been treated, and now it's all right. Fred Hollows came into the community, and this is the way they showed us the pathway that leads to good eyes. Make a community safe for the people. Now we can see and go out somewhere. Maybe hunting, play footy, play softball, whatever things they want to do in the community. Trachoma is everybody's business.
Great. So we now move to the second part of our programme, where we're going to focus on the central recommendation of the report that the Commonwealth should commit to quality eye care for children through school-based eye tests and care for all children to boost educational attainment and life chances for present and future generations. And I'm delighted to introduce Dr. Edwin Dicalotti, who's the Minister of Health and Wellness in Botswana. He's a trained veterinary surgeon and former Minister for Agricultural Development and Food Security. And he's going to talk to us about Botswana's groundbreaking school eye health programme. Dr. Dicalotti.
Thank you very much, Director of Ceremony, Your Royal Highness, Secretary General, Excellencies, Honorable Ministers, colleagues from the eye sector, distinguished guests, ladies and gentlemen, greetings. Director of Ceremonies, it gives me great pleasure to participate in this auspicious event, which concerns itself with eye health and prevention of blindness globally. I wish to applaud the organizers for their thoughtfulness on engaging in a very important issue that is often neglected. It is also commendable that this happens in the midst of the COVID-19 pandemic. This spirit ensures that preventable blindness is not a forgotten item on the public health agenda. For your appreciation, ladies and gentlemen, I would like to highlight that refractive error and cataract are the leading causes of preventable vision impairment and blindness in Botswana. It has also been established by some studies that glaucoma is an area of concern in the country. Botswana recognizes the significance of eye health, especially for children, as it will relate to the development of the child, education, social well-being, and economic independence of these individuals. As such, the country is engaged in efforts to integrate eye health and blindness prevention within her national healthcare system. The National Eye Health Program is geared towards reduction of avoidable blindness. This will be achieved through screening of walk-in clients, referral from other services, and public campaigns and many other interventions. The advent of COVID-19 has led to the stalling of cataract campaigns, which is a major strategy for identifying blindness due to cataracts and referral for corrective surgery. We have included eye health in our tools for the national guideline for the implementation of integrated community-based health services of November 2020 as a means of increasing demand for eye health services nationally. Moreover, as part of our efforts to advance the Vision and Eye Health Program, we engaged several partners. Notably, we worked with a consortium of partners led by Peak Vision, and we successfully implemented a school eye health program using a smartphone-based screening and referral system. Through this initiative, the following results were achieved. 12,877 children across 49 schools were screened in 3 weeks. 2,065 were identified with potential eye health problems. 835 children received spectacles, 94 received medication, and 63 were referred for further ophthalmic services. It is worth noting that prior to this program, less than 10% of those children needing services were reached. Now with this exciting new innovation and approach, over 90% of children identified were treated. Over a period of 3 years, we are rolling out a national government-led program named Pono Yami, which means My Vision. My ministry, in partnership with the Ministry of Basic Education, are partnering with Peak Vision to ensure every school child with eye problems in Botswana is identified and treated. The program is backed by His Excellency, the President of the Republic of Botswana, Dr. Mokgweetsi Masisi, a former school teacher who personally has endorsed this work and wishes for Botswana to be a world leader in vision in the way we have been with HIV. Now is the time to act to ensure an entire generation see the world clearly and can achieve their full potential. Some of the key benefits envisaged to come with the proposed program include better educational performance for a generation of school children, increased employment and productivity opportunities on completion of education, better physical and mental well-being, reduced loss of productivity due to direct and indirect reasons, increased employment opportunities to those delivering the program, a global case study, an example for replication worldwide. Chairperson, we continue to rely on various partnerships regionally and globally to advance the implementation of our eye health strategies and plans. We need as a country to build capacities for specialists and skilled personnel with the requisite skill. Director of Ceremonies, once more, I congratulate the Vision for the Commonwealth Coalition for hosting this event and for sharing the eye health in the Commonwealth Progress Report 2018 to 2021, whose findings and proposed interventions are aligned to our accessions towards improving eye health within the Commonwealth states. More platforms are needed to increase knowledge, skill, and information in order to achieve the targets of an integrated eye care by 2030. I thank you for your attention.
Dr. Dikologsi, thank you very much indeed, and thank you for the example that you're setting on school eye health. And now I'd like to introduce our final speaker, Jo Frost, who many of you will know as TV's Super Nanny. And as anybody who's seen Jo Frost on TV, you'll know that she's always right and we ignore her advice at our peril. Here's her message on children's eye health.
Your Royal Highness, Secretary General, Your Excellencies, Honourable Ministers, ladies and gentlemen. It is a pleasure to join you today from early hours in the morning across the pond to mark the progress that the Commonwealth has made on eye health in recent years, and to importantly talk about child eye health. It is a cause I'm passionate about, as I believe, like I once remember as a young child myself wearing glasses, that offering sight tests and affordable treatments, including glasses, to all school children across the Commonwealth would totally transform the life chances of generations to come. In 2018, the Commonwealth committed to take action towards achieving access to quality eye care for all. Since 2018, despite the challenges of the COVID-19 pandemic, huge advances have been made in tackling trachoma and improving access to quality eye health. Many Commonwealth countries have begun to address children's visions in schools, improving their school performance, building their genuine self-esteem and abilities, thus enabling them to reach their full potential. This topic is important. There are 1.1 billion people globally without access to the eye health services they need. That is 91 million children, our future, who live with vision loss. So detecting and addressing vision loss amongst children by having school-based screenings can identify other vision issues, including trachoma, helping to get them addressed promptly. Without action, vision loss amongst children is projected to grow rapidly in the years ahead. This is about our children's lives and futures. It's about their education, because by correcting the vision of primary school students, you can help boost test scores by the equivalent of up to 6 months of additional schooling, with glasses being one of the most effective health interventions for children, reducing the odds of failing a class by 44%. Many Commonwealth countries are already making progress, like Rwanda, India, Samoa, New Zealand, Antigua and Barbuda, with screenings providing free glasses for disadvantaged families and children having vision checks in schools for tiny 4-year-olds. So this year, the vision for the Commonwealth Coalition is asking that Commonwealth leaders commit to providing glasses in classes as part of their focus on the youth of the Commonwealth, ensuring that no young person is left behind because of treatable poor vision. Let's give every child the best start in life, because to me, every child deserves no less.
Joe, thank you very much indeed. So we've now reached the point in the session where we can open up for questions and comments from the audience. So if you have a question you'd like to ask any of the panelists or would like to make a comment, please do let us know using the Q&A function at the bottom of the screen. And I wonder if I could kick off with a question for Caroline. Caroline, you've talked about the elimination of trachoma potentially being in our grasp, but there are obviously enormous challenges that we face. And I wonder if you could talk a little bit more about them, but particularly perhaps the impact that we've all of COVID-19 over the past year, and how that is perhaps impacting on the work to eliminate trachoma and implementing wider eye health services.
Yeah, sure. I will mention COVID, but I think perhaps the biggest barrier that's been most challenging all through is where you have conflict situations. And I guess when I'm looking back and currently within the Commonwealth, parts of Nigeria have been particularly difficult, dangerous to reach for people. So I think whilst you have conflict in those areas, that's always going to be a real challenge to eliminate in the whole country. But then when we look at COVID-19, well, there's several aspects really. I mean, initially, well, when the pandemic hit, WHO asked countries to pause all of the interventions, certainly mass drug administrations or, the big screening camps. Now those restrictions have been lifted because we've worked out with WHO how to do this in a COVID secure way. As you can imagine, a TT surgery, for example, trachoma surgery, it's very close work. And therefore more personal protective equipment is needed to be able to do that. all of this drives up the cost of doing trachoma work. And this kind of COVID secure premium, if you like, will be needed for quite some time across Africa, because obviously the vaccines are not rolling out at the speed in Africa that perhaps we'd all like, and certainly that we enjoy in the UK. But then I think, you know, as I said, the most important thing is to maintain commitment to trachoma. A number of things. First, obviously, the importance of water and sanitation. But then as you get closer to elimination, the costs do go up. It's more case finding is needed to reach people that need surgeries, for example. And then you must maintain surveillance. So once you've been able to stop the mass drug administration, you still need to maintain that surveillance to make sure that you really have eliminated that disease and it's not coming back. And that requires donors and ministries to maintain that commitment after the very big MDAs with a very large number of people are part of the past. So it's staying the course and tenacity that are perhaps most required here.
Yes, I think that's a lesson for all of us, actually, across eye health. Ambassador, I wonder if I could turn to you. You talked about the resolution, the UN resolution, that we hope will be agreed very shortly. And I wondered if you wouldn't mind just telling us a little bit more about it and perhaps what Commonwealth countries can do to support it.
Thank you, Peter. And I think what's important is the work that Ambassador Webster and his colleagues are leading at the United Nations, which is forcing conversations in spaces where those conversations normally did not take place. And all Commonwealth countries are members of the United Nations. And so we'd want to encourage member states to be a part of that focus group and to support the resolution when it comes to the fore. And I think the question of consistency in support is what is critical at this point. I think Caroline said it best in her very impassioned appeal to her government about not dialing back on support. So I think it's just important for Commonwealth countries to be aware, to be having conversations about eye health and doing their part at the UN to support this resolution when it comes to the fore. Great,
thank you very much indeed. Dr. DiCarlotti, again, I think the example that Botswana is setting with your program on school high health is exactly the sort of example that we're hoping that can be taken forward with perhaps an emphasis across the Commonwealth on school high health services in the future. I wonder what advice would you give to other countries across the Commonwealth in implementing school eye health programs?
Thank you very much, Peter. I would say, the advice that I would give to that is you really need to have, political commitment from the highest level. Because once we have that commitment from the highest level, like we have from the President of the Republic of Botswana, it makes it a lot easier for you because you need resources in order for you to really roll out, this initiative. And with that kind of support, it becomes easier to mobilize resources. It becomes easier to even, capacitate, your human resource. And that is what I would really advise, that, we get that, buy-in and that commitment from the highest level, is the key thing for you to really have this achieved better. Thank you.
Thank you. Thank you very much. And we've got a question from Joseph Kabakeza from the Rwandan High Commission. And let me read it out and I think this is perhaps a question for all the panelists. So obviously dealing with COVID-19 has siphoned funds from many economies. So what are the sorts of arrangements in place to sustain pre-COVID initiatives in the eye health sector, especially as the economies are affected as economies are affected now? And are you seeing donors withdrawing support? And Dr. DiCarlotti, perhaps to start with you, but we could ask other panelists as well.
Thank you very much. It has not been easy to try and really balance the two, but it also depends on the resilience that we have built within the healthcare system. For us, we've been very fortunate in that, our primary health care is really, it's a robust system that we've built over a period of time. And this has really helped us to be able to carry on to do other activities, even though we had COVID. That has been the priority of late. So it really depends on how strong and resilient your health system is. But we work a lot with partners. They've been very, very helpful. I mean, your WHO and all other partners. They have come very handy to us, and they have, together with them, we have really managed to pull through despite COVID. Thank you.
Great, thank you. And Caroline, from your experience.
Yeah, I should actually really have a shout out to the philanthropists who have stood by us all through. So even when we weren't able to distribute or to operate during the height of the pandemic, WHO ban, they just said, we'll stand with you however long it takes. We want to eliminate trachoma. We want to be with you through this period. And we've also seen a number of other donors. So the USAID has just reapproved its budget for neglected tropical diseases with a 1% increase. And that's happened very recently. And obviously that includes trachoma. So we are seeing a lot of donors standing in solidarity. But, obviously, it is a difficult time with COVID and the amount of money that's going to be required for that. But I just think global health needs to be prioritized generally. So frankly, if you on trachoma, if you walk away now, it'll all come back and all that investment will be lost, and the burden it will put on the health system of trying to deal with all of that, when really it needs to be dealing with other priorities. It's part of the reason why we've all made so much effort over so very long. So as I say, most donors we are seeing are standing with us.
Caroline, thank you. And I think that message about how we have to prioritize global health is what I'm sure we all absolutely share. We are unfortunately now coming to the end of the program, but I would obviously like particularly to thank our panelists, Your Royal Highness Countess of Wessex, Baroness Patricia Scotland, Minister Dr. Edwin DiColotti, Ambassador Karen May Hill, Caroline Harper, and Joe Frost. Thank you so much for your contributions, which I know I'm sure the whole of the audience has found enormously both valuable and inspiring. Today has, of course, been about celebrating the outstanding progress within the Commonwealth and the leadership the Commonwealth has shown the world on improving the eye health of its citizens. But it's also about what we do next, about the Commonwealth continuing to lead the way on quality eye health for all, on finishing the job of trachoma elimination, and on committing to sight test affordable glasses and eye care for all our children to ensure they have the best possible start in life. That's our vision for the Commonwealth. Thank you very much for joining us.